Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is what you need to know about fibromyalgia. Fibromyalgia is a connective soft tissue disease involving chronic, spontaneous, and widespread musculoskeletal pain, as well as recurrent fatigue and sleep disturbance. The condition presents multiple tender spots on the body that are typically found on the back, neck, chest, hips, arms, and legs. In the past, it's been referred to as chronic pain syndrome, psychogenic rheumatism, and fibrositis, but generally people have settled on the term fibromyalgia nowadays. How common is it? 3.4% of women in the U.S. and 0.5% of men have fibromyalgia, with a typical age range of 30 to 50. 3/4 of those with fibromyalgia actually go undiagnosed, so those numbers are really much higher. How do you know if you have it? Well, there's some guidelines that have been put in place by the American College of Rheumatology. History of several areas of aches or pains for a minimum of 3 months. Have at least 11 of 18 locations on the body that are significantly tender. And if it's close but not quite to the diagnosis, it's called myofascial pain syndrome, but the treatment is the same. So here's the 18 areas: neck, shoulders, elbows, knee area, and then on the back you have the hip, just at the low back there, and then up around the shoulders and neck. There's also some guidelines from the American Medical Association. These are almost 30 years old. The major criteria is generalized chronic aches and pains or stiffness present for over 3 months in 3 or more anatomical areas, several tender points, and then no other identifiable condition that the symptoms could represent. So it sort of falls down through an algorithm. And then the minor criteria you can read there: fatigue, headaches, neck and shoulder pain, sleep disturbances, bowel issues, and then some subjective numbness and swelling. Oftentimes it becomes a diagnosis of exclusion, because remember, if it's not specifically fitting into the diagnosis of fibromyalgia, then the treatment ends up still being the same. Looking at the treatment options, the Mayo Clinic proceedings in 2005 recommended alternative medicine. This may include acupuncture, chiropractic adjustments, physical therapy, massage, aromatherapy, homeopathic medicines, spa baths, relaxing herbals, music therapy, and yoga. So any or all of these may have some beneficial results. When it comes to medications, there are quite a few that can be beneficial. Antidepressant medications can be used off-label for fibromyalgia. Analgesics, such as nonsteroidal anti-inflammatories, muscle relaxers, Tylenol, opiate medications may be beneficial. Membrane stabilizing drugs such as Lyrica, sleeping aids, and then Myers cocktail is an IV infusion of vitamins and minerals that has been shown to help in a lot of fibromyalgia patients. There are some FDA-approved medications for fibromyalgia. Lyrica was the first back in 2007. Shortly thereafter, Cymbalta was approved, and the latest was Savella in 2009. To be honest, we don't know how any of these work, okay? We just know that they do work, so the FDA approved them when the studies bore that out. Myers cocktail, there was a 2009 pilot study. Most subjects experienced relief as compared to baseline, but they could not get a statistically significant difference in that pilot study. So they need to do a larger study. It just hasn't been done. But it's such a low-risk treatment, and a lot of patients get benefit out of it, that it's widely performed across the country for fibromyalgia. There's no cure for this condition. It's a challenging one. New studies are showing that patients can decrease symptoms dramatically through multimodality treatment, and that's from literature put out from the National Fibromyalgia Association. The top pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options. The board-certified award-winning doctors have very high success rates. Visit us online at newjerseypainnetwork.com, and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.